Lactose intolerance and dairy sensitivities are on the rise. This is especially true for those with gluten sensitivity. Now, it's no mystery that gluten can damage your GI tract, but gluten has also been shown to reduce the body's ability to produce the enzyme lactase. Lactase is necessary to break down lactose, the carbohydrate found in dairy. Inability to break down lactose can lead to gas, bloating, abdominal pain and discomfort, as well as flatulence. In addition, casein and whey, proteins found in dairy, have been shown to cause intestinal inflammation in up to 50% of those with gluten sensitivity. That's why I designed Dairy Shield. This premium digestive enzyme formula was created for those who struggle with lactose intolerance or dairy sensitivity. This comprehensive formula contains enzymes that support the breakdown and digestion of lactose and dairy proteins. The key ingredients in Dairy Shield include, number 1, lactase, an enzyme proven in studies to quickly and efficiently degrade lactase while reducing associated dairy intolerance symptoms. And number 2, protease, a powerful enzyme that supports the digestive breakdown of milk proteins while helping to maintain a normal immune balance in the gut. Now, this product can be used in a couple of different ways. If you are lactose intolerant, take 1 to 2 Dairy Shield capsules about 10 minutes before consuming dairy-based foods to help support better digestion of lactose. If you're allergic to dairy, it's important that you understand that this product is not designed to help you eat dairy anyway. Food allergies should be taken seriously and avoided. That being said, the enzyme blend was designed to break down dairy proteins that you might be exposed to through cross-contamination of food or when eating out. Hence the name, Dairy Shield. Bottom line, Dairy Shield can help protect you from dairy cross-contamination, and it can help support digestion of lactose for those with lactose intolerance. And like all of our products, Dairy Shield is gluten and grain-free, contains no artificial colors or flavors, and is formulated and bottled in the United States. The food guide pyramid says you should eat this food. Doctors and nutritionists say you should eat this food. But today we're going to discuss why you might not want to. We'll be right back on this episode of Dr. Osborne Zone. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne Zone. Welcome to Dr. Osborne Zone. Today we're going to be doing a deep dive on dairy. Does it cause or contribute to autoimmune disease? And many of you watching this might have an autoimmune diagnosis. Diseases like rheumatoid arthritis or Hashimoto's hypothyroid, or autoimmune liver disease, or ankylosing spondylitis, or multiple sclerosis, or type 1 diabetes. Again, these are forms of immune disorders, and dairy may be playing a role in the genesis of yours. So let's check it out. Is dairy a health food? So this is an amalgamation from a major research review study showing the different types of autoimmune conditions that so far to date have actually some research association with the onset or with dairy. So we can start up here on the upper right. You see bipolar disorders, autoimmune uveitis. So this is eye disease, eye inflammation. We have MS or multiple sclerosis, as well as celiac disease, type 1 diabetes, rheumatoid arthritis, inflammatory bowel. So this would be like Crohn's or UC, which is ulcerative colitis, as well as autism spectrum disorders, juvenile idiopathic arthritis, sometimes referred to as juvenile rheumatoid arthritis. And then we have idiopathic membranous nephropathy, which is a kidney disease, as well as schizophrenia, mental disorder, and Behçet's disease, which can cause lesions on the skin and ulcers on the skin. So all these different conditions have been in some way associated with the consumption of bovine dairy. Now, I think it's important that we back that up. So this actually coming from a major review paper, but let's look at some individual papers on these linkages. So in this first one that I'm pulling up here, you can see mucosal reactivity to cow's milk protein in celiac disease, showing that a mucosal inflammation response similar to that elicited by gluten was produced by cow's milk protein in about half of the patients with celiac disease. Casein in particular seems to be involved in this reaction. So in this particular study, half the people had a reaction and the other half didn't, but that's pretty profound when you consider how many of you have gone gluten-free and continue to use dairy, but continue to also struggle and have potential problems. Then we have this one as another review study, so bovine milk proteins as a trigger for autoimmune disease, myth or reality. You can see here in this review, the high incidence of allergies to cow milk components in autoimmune diseases is rising. So this is important to understand, is that this didn't just happen. This is not something that has been going on forever, but this is an unfortunate element in our society that is increasing with time. So it's rising, especially in Western industrialized countries where milk is a major dietary component, especially in processed foods. I think it's important to highlight that, because there'll be many of you watching this wondering about, well, what about raw dairy, or what about healthy dairy from potentially grass-fed, grass-finished cows? We'll get into that in a moment, so stay with me. But processed foods, again, when allergenic milk proteins face immature and susceptible immune system in children, it might represent a threat for future health. In other words, kids that don't have a fully developed immune system, a lot of times what happens in infancy is we get these kids that maybe they're not being breastfed, and so mom is giving them some kind of formula milk that's cow derivative, and their immune systems aren't fully developed. This is what they're referring to here. So formulas and other milk products given to infants. Okay, so again, moving on here. Several studies support strong evidence that exposure to dietary allergens during childhood can increase the risk of developing, what are we talking about here? Autoimmune diseases, such as type 1 diabetes, celiac disease, inflammatory bowel disease, rheumatoid arthritis, multiple sclerosis, neuropsychiatric disorders. Again, what did we say over here? We said, one of the conditions here, schizophrenia, neuropsychiatric, as well as autism spectrum and bipolar. Again, these are neurological in nature. Okay, so we've got that study. Let's move it out of the way and let's pull up. Actually, I'm not ready for that one. Let's move over here. So this next one is on MS, and this one's actually recently published. You can see here the results obtained from these researchers were doing research in mice, and then they crossed that over into human studies. And so you can see the research obtained, or results obtained from the mouse model, were complemented by clinical data showing that serum samples from patients, human patients now, with multiple sclerosis contain significantly higher B cell and antibody reactivity to bovine casein. Again, bovine being cows, casein being the primary protein in cow's milk, than those from patients with other neurologic diseases. In other words, these people with MS had higher reactivity to bovine casein protein. This reactivity correlated with the B cell response to a mixture of central nervous system antigens and could again be attributed to reactivity. While we acknowledge disease among individuals with MS, we believe that consumption of cow's milk in a subset of patients with MS who have experienced a previous loss of tolerance to bovine casein may aggravate the disease. In other words, they're not saying that everyone with MS has dairy as a cause, but they're saying there's a subset of people with MS where dairy may play a major role in the aggravation or the irritation of the immune system, leading to a progression of the illness itself. So you can see here the final statement here, which is, our data suggests that patients with antibodies to bovine casein might benefit from restricting dairy products from their diet. So what's what's the takeaway with that? I mean, aside from, people with MS just avoiding dairy, if you've got MS and you're wondering whether or not you should avoid dairy, the takeaway for you is get tested. If you don't want to restrict your diet, if you're hesitant to restrict your diet, but you are suffering, get tested. Go to your doctor and ask them to test for, bovine reactions. Predominantly, there are several different cow's milk proteins. There's casein being one of the predominant ones, but there are a number of other ones like albumin and lactalbumin, etc. So get a battery of tests for a multitude of different types of dairy protein reactions and correlate whether or not it's something that you should be doing, again, especially if you have active disease state. Okay, let's pull this next one up. So you can see here dietary factors and risk of islet autoimmunity and type 1 diabetes, a systematic review and meta-analysis. Again, recently published paper, numerous dietary components. You hear me say this all the time. Numerous dietary components have been linked to the development of islet autoimmunity and type 1 diabetes. However, moving down here, so the interpretation of the study suggests that breastfeeding and late introduction of gluten, fruit, and cow's milk may reduce the risk of type 1 diabetes, whereas high childhood cow's milk intake may increase it. So going back to what I said earlier about babies and formula, you've got so many babies today being given dairy-based or cow dairy-based formulas, and what this study is saying is that the reduction of risk for the development of type 1 diabetes is possible when avoiding cow dairy. Also, they mentioned gluten and fruit. Now, one of the interesting things about this, and I want to just comment a little bit more on this here, is that if you look at what most pediatricians recommend, if you look at like American Pediatric Association or Society, and what they generally recommend to infants, the first food that generally is recommended for infants, and this is generally between the age of a few months and up to 6 months, is baby cereals. Now, baby cereals contain what? They contain gluten. And gluten does what? It increases the risk for the development of autoimmune disease, especially in genetically predisposed individuals. So this is the first food they recommend. What's the second food that's generally recommended? Is fruit. Okay, so you got the first and the second, and then if the baby can't breastfeed, and again, I'm not picking on any of you that couldn't breastfeed or didn't produce the milk, but the fact of the matter is formula sales are astronomically high, and in my opinion, they're way too high. There's way too many babies being formula fed because we know that the potential detriment, the number one ingredient in formulas, in baby formula, is typically some form of sugar, particularly fructose from GMO corn. Number one ingredient. You think that's what babies need to make them healthy? I mean, it's no wonder we're an obese nation. We're giving, so many of these children are just sucking down sugar disguised as milk formula. And when you take that into account, the fructose here and the fruit here, and then you add to it the dairy element of the actual formula itself, and come back to this study and you look at, okay, what are they saying? The study suggests that breastfeeding and late introduction of gluten, fruit, and cow's milk may reduce the risk of type 1 diabetes, whereas high childhood cow's milk intake may increase it. It's kind of a no-brainer. Your kids need real food, ideally not processed food. Remember, formula is processed. And as we'll show you in just a minute, processed food is one of the problems, and how we process the food can actually increase the risk, especially the dairy, for the development of autoimmune disease. So, major problem. Actually, on that note, let's just talk about the processing. So this is a research study on milk processing. And so what they're showing here, that you see the title, Milk Processing Increases the Allergenicity of Cow's Milk, Preclinical Evidence Supported by a Human Proof of Concept Provocation Pilot. Conclusion and clinical relevance. The study demonstrates that raw, unprocessed cow's milk and native whey proteins have a lower allergenicity, meaning they're less allergic, than their processed counterparts. The preclinical evidence in combination with the human proof of concept provocation pilot provides evidence that milk processing negatively influences how allergic the milk is. So again, processing, not a good thing. How many times have you heard a doctor or nutritionist say, quit eating processed foods? Well, these are some of the reasons why. Okay, I got one more to show you here on milk and autoimmunity as a whole. The cow's milk and autoimmunity, another review paper. This again recently published. You see here allergic reaction. So again, this is a summary of studies. I just wanted to point this section out down here. Allergic reaction in mice with CMA. Now these are mice studies with cow's milk allergy are associated with numerous autoimmune disorders, multiple sclerosis, rheumatoid arthritis, systemic lupus, and some other examples. So, and then you can see here, additionally, the inflammation which becomes chronic because of cow's milk allergy may contribute to a group of autoimmune diseases. This review aimed to better understand the relationship between cow's milk and autoimmunity. So, a lot of studies, a lot of research reviews and meta-analysis of prior studies that confirm there's definitely an association between cow's milk and autoimmunity. So then the next question is, well, is it all milk? Or is it just cow's milk? Or is it because the cow's milk is being processed? Or is there something else going on? Now, I want to scroll over here for just a minute because there are some other things going on, and let's talk about some of those. So some of the other problems linked to just dairy and the way it's been processed and the way that we mass produce it in industrialized countries, there are some other things that we can find, and these are just examples. So we can find toxic metal and mycotoxins, especially aflatoxin is commonly found in dairy. Pesticides, processing may also increase allergenicity, as I've just shown you, that research study, and then as well antibiotics. And so we have, these are just, again, general things that occur as we mass produce milk, and they can become problematic. And so the question then becomes, if these things are happening, is this why people are more and more reactive to dairy as a whole? You can see in this review several hazards of contamination of cow's milk, ranging from biological to chemical compounds. You see equipment, storage, dirty pipes, other chemical contamination of cow's milk can come from several other sources, such as the application of agrochemicals like pesticides. You know, you think about what most dairy cows are fed. I was actually recently I went and visited one of these mass production dairy farms because I wanted to get an insight and an understanding of how things worked. And in this particular farm I went to, they were milking these cows every 8 hours. They were using different types of hormones, and they were using a sugar-loaded, grain-based feed that was GMO, meaning GMO, genetically modified feed. As well, that feed had been sprayed twice with glyphosate for its harvest, pre-harvest, post-harvest. So again, agrochemicals, what we're referring to here. And then the use of legal or illegal veterinarian products. And this can happen, you know, not all dairy farmers are honest. I'm not saying that all of them are dishonest, but you might get some farmers that are illegally using certain types of veterinarian products to, you know, to treat their animals. And then you have the intentional treatment, so actual true treatment that's necessary. And so they may be using antibiotics, they may be using different hormones, among other things. Again, in the environment, you can get contamination of mold toxins, pesticides, and heavy metals. This is, you know, depending on the farmland and depending on what that farmland has been treated with, or depending on what's been dumped on that farmland, etc. And then you have the processing. So once you get the milk, then that goes into processing, and during industrial processing, you can get contamination of more metals as well as mycotoxins. And then pasteurized milk or heating milk up, the research is pretty clear on this, that when you pasteurize milk, you cause a lot of nutritional deficits in that milk. So it destroys a lot of the nutrients that might have been there. But you also get an increased allergenicity. As I showed you a moment ago, the processing, the ultra high temperature processing of milk products increases the risk of allergenicity. So again, this is just how it's done. And, you know, take it or leave it, we feed a lot of people in industrialized countries, and so some would argue that without these types of processes, people would starve to death. But I would argue that there's a way to do it. Once we understand that it's harming people, there's a better way, there's better innovation that can be thought of and done to not harm people, but still be able to feed all these people. Now, we also can see here in this study, this was actually a Stanford publication, but infants in industrialized nations, keyword here, industrialized nations, right, are losing a species of gut bacteria that digests breast milk. Now, this should be rather alarming to any of you hearing this. What is that bacteria that they're losing? That bacteria is Bifidobacterium, and it's critical for breaking down milk, digestion of milk. And without it, you're going to get a lot of, not so much allergy, but you get something called intolerance. So the difference between an allergy and an intolerance is an intolerance means inability to digest, whereas an allergy is an immune response, a direct immune response to a particular protein or particular element of the milk. So this intolerance can occur because, remember, Bifidobacter helps us to digest our food. It's one of the predominant species in infants. It's actually one of the most abundant species in human GI tracts, or at least it's supposed to be. But you can see in industrialized countries, this species is diminishing, and we're seeing this go away. Now, why would we think that this is happening? I mean, there are a lot of reasons potentially why this might be happening, and one of them is the mass use of cesarean, and I would go so far as to say unnecessarily, right? So it's not necessary to use cesarean as many times as it's being recommended. I mean, a lot of OB-GYNs will schedule the pregnancy. A lot of women want to schedule their pregnancy for a certain date. You have to understand the consequence of a cesarean. It's a great tool to save a woman and a baby's life if it's necessary and there's emergency or a medical need for it. But what a cesarean does, remember how a baby gets bacteria. The way a baby's GI tract gets colonized by bacteria is through the vaginal canal. So when babies are coming out, they're generally their mouths wide open as they come out, and what happens is they're being inoculated. Mother's fluids and bacteria from her vaginal canal are inoculating the mouth of the baby, and this leads to basically a seeding of healthy bacteria so that baby's immune system can begin developing. Because remember, these bacteria are not just important for digestion, but they're important for immune system development and so many other things. These bacteria are responsible for helping produce vitamins. They're responsible for preventing leaky gut. They're also responsible for communication to the immune system. So Bifidobacter talks to the immune system of the gut. There's 70% of the immune system's in the gut, in the form of what we call the GALT, the gastro-associated lymphoid tissue. And that's, again, 70% of the immune system, and this Bifidobacteria communicates to it, and the immune system communicates back. There's actually a name for this. Scientifically speaking, it's called immune crosstalk. And this has been validated and discovered in a number of studies where, again, the healthy bacteria of the GI tract communicate with the immune system, and there's this back and forth messaging that says, hey, we got a problem, or hey, we need help. And so this could be, these cesareans leading to a lack of colonization of Bifidobacteria in infants may be affecting the immune system crosstalk, leading to a confusion that causes or increases hyperallergenicity, not just to milk protein, but to many things. And we're seeing this in kids in industrialized countries. It's not just milk allergy, it's allergy to lots of things. And so this is a big one, in my opinion. Now, some of the other big ones, in my opinion, have to do with the broad spectrum use of antibiotics. You get a lot of nervous young mothers with inexperience. Again, this is not, I'm not trying to shame any of you listening to the show. It's just the reality. There are a lot of young mothers with inexperience that get scared when their babies get a fever, and what do? They go to the pediatrician and they want the antibiotic. And so the pediatrician prescribes the antibiotic instead of saying, let's just let the baby's immune system try to beat this thing. A lot of times they get the antibiotic. I call it just in case, right? It's the just in case antibiotic, just in case you need it, here it is. And then the baby gets the antibiotic, and a lot of kids, they're getting, before they're the age of 2 or 3, they're getting 4, 5, 6 doses of antibiotics, decimating their bacteria. right? And so you couple that with that decimation, that widespread use of antibiotics. Maybe that child was also born by cesarean delivery, and they have no bifidobacteria, or they have very little colonization of bifidobacteria, so their immune system's not developing properly to communicate that which food is an enemy and which food is a friend. And so now they're becoming hyperallergenic, and they're developing all kinds of problems, autoimmune problems like asthma and skin diseases and allergies, and other autoimmune diseases, as we've talked about earlier, like type 1 diabetes. The risk of type 1 diabetes, or the incidence of type 1 diabetes, has gone way up. So again, the babies that are being born today, and have these environmental factors that can potentially decimate or reduce the capacity for their guts to have good bacteria, thus increasing the potential to react to food. Now, we also have, individual problems in people that are gluten sensitive. So there are some additional issues. So if you're gluten sensitive, many of my audience, many of my followers are gluten sensitive, and that's why they follow me. That's why they follow the no grain, no pain diet. And so this is for you guys. This is specifically for you guys. So if you're gluten sensitive, there are a lot of problems in the research that we know associated with milk. And so this diagram will help you understand those a little bit better. We have, one is that the addition of too many dairy products is not that just pure milk has meat glue in it, but meat glue, otherwise known as microbial transglutaminase, is a bacterial-derived food additive, and it's used generally to increase the viscosity or thickness or palatability of foods. And it's commonly found in things like ice creams and confections and desserts that are dairy derived. So you're not so much getting meat glue in milk per se, but you're getting meat glue in dairy products. And that can be problematic, and let's talk about why. So meat glue, some really good researchers, Aaron Lerner and Matthias, published this review in Nutrition Reviews on the industrial use of MTG, which MTG is meat glue. And so in their paper, they talk about how meat glue, because it has this very close similarity, you see that term microbial transglutaminase. Well, there's an enzyme in patients, or not just in patients with celiac disease, but there's an enzyme affected with celiac disease called tissue transglutaminase, or TTG, and this is commonly the source of the autoimmune reaction for celiacs. And so there's such similarity between that MTG and the TTG that we see an immune response that, potentially is eliciting a celiac response. And so those of you who are gluten sensitive and you're eating foods that contain meat glue, there may be a mimicry there that can exacerbate your celiac disease. There also may be, for those of you who don't have celiac disease but have non-celiac gluten sensitivity, there may also be a mimicry there of that meat glue creating or driving what we call non-celiac symptoms, or extra-intestinal manifestations, because celiac disease is usually diagnosed as a result of intestinal damage to the villi, to the folds of the small intestine. But there are numerous other types of conditions that we know gluten can induce, or gluten mimicking agents can induce, and this has to do with autoimmune disease. So again, these are autoimmune inductions, and so if you're using meat glue on the daily basis, you could be increasing your risk for the development of autoimmune disease as well. And again, dairy, because it contains meat glue. Many of the dairy products, I should say, contain the meat glue. You got to be careful. So as we keep going down this list, another potential issue is lactase deficiency. Again, unique to not just unique to people with gluten sensitivity, but more common in people that have gluten sensitivity. Because why? Because gluten damages the small intestinal cells and that brush border inside of your GI tract. And what's important about that is the brush border produces lactase. Now, what is lactase? Lactase is an enzyme that helps you digest lactose. Lactose is the sugar component of dairy. So it's the sugar of dairy. In order to break it down, you need lactase. So lactase breaks down lactose so that you're capable of digesting it. And if you have gluten-induced damage and you have a reduction of lactase, then you may not tolerate the consumption of dairy. And so many people, again, with gluten sensitivity are more prone to this problem. And this is one of the reasons why, if you look at people going gluten-free, there's actually a type of diet. It's the gluten-free, casein-free diet. And some people go gluten-free, dairy-free diet. And these are some of the reasons why. But you can see here nutrition in this study, nutrition in patients with lactose malabsorption, celiac disease-related disorders. Lactose malabsorption, celiac disease, non-celiac gluten sensitivity, and irritable bowel syndrome are conditions associated with food triggers. Improvement after involvement or improvement after withdrawal treatment with dietary restriction and subsequent nutrient detriments. Bottom line is, individuals that have that intestinal damage are more prone to not producing adequate lactase, which is the enzyme that breaks down dairy, making these individuals more susceptible to dairy intolerance, thus reacting to that dairy. Now, what happens when you eat a bunch of dairy and you can't digest that sugar is it ferments in your GI tract. What's a byproduct of fermentation? Is alcohol. Well, what does alcohol do to your GI tract? It causes damage. And so if you are consuming a lot of dairy, the dairy itself is not directly inflammatory, but if it ferments because you can't digest it to produce alcohol, now you're getting damage to your GI tract. And there's some research studies that show that alcohol can actually cause villus atrophy. So we see a lot of people with celiac disease who go gluten-free but maybe don't go dairy-free because they're reacting to the dairy. This process can continue or perpetuate their GI damage and continue to increase their problems. So just something to be aware of. We also know that there's a substance in dairy, A1 dairy particularly. Now we'll talk about A1 versus A2 in just a minute, but BCM stands for beta-casein 7, and it's found in A1 milk. Now what is A1 milk? A1 milk is what most dairy in the U.S. and other industrialized, like the U.K., the U.S., Canada, Europe, the milk cows are A1 producers. What is A1? A1 is a type of casein, so it represents the type of casein. Remember, casein is the most predominant protein found in dairy. Now, many breeds of cows are A1 producers, but there are types of cows that produce A2 casein. And A2 casein is reportedly better tolerated. Now, humans, goat, sheep all produce A2 casein. And some cows produce A2 casein, but not all. And where our dairy herds are producing, the majority are A1. So again, when you're eating dairy from the standard grocery store, it's A1 casein. And so there's a protein when you're breaking down A1 casein that's formed in the intestine called BCM7, beta-casein 7. What is this? It is a morphine agonist. So it mimics morphine. Now, what does morphine do to the GI tract? One of the things it does is it slows down gut motility. And so what's one of the major problems that people have in industrialized countries as far as GI problems is IBS. Specifically, in this case, if we're reducing motility, we're causing IBS constipation. So, this is an affect, if you will, or can be, of the morphine mimicking effects of BCM7, which again is a derivative breakdown of A1 casein. Now, there's some other problems with A1 casein, and there's some nice reviews that talk about some of these problems. And this one, again, recently published. But you see a release of BCMs in the gut by digestive enzymes. So you got these little these little green spherical structures are BCMs. And then what they do is they can break through the barrier, so they can actually contribute to a leaky gut or a leakiness of the GI tract. Once they can get through, they can cause an activation of mast cells leading to a release of histamine. So many of you, report that when you eat lower histamine foods that you feel better, histamine being a vasoactive chemical that can cause the symptoms of allergy. So a lot of people with excessive histamine, that they can't deal with that histamine, struggle with histamine-like symptoms, and this could be anything from watery, teary, itchy eyes to sneezing to coughing to mucus production in the GI tract to mucus production in the lung. If that histamine transports into the bloodstream, it can cause a number of problems in the bloodstream, contributing to blood problems. You can see wheals and flares of the arm, so you can get skin reactions as well, but then it can also traverse to the pancreas and cause the destruction of the beta cells. And this is part of how we learned about A1 casein and BCM7 is that the dairy products were being brought into New Zealand, and the Maori tribe folks, the tribal folks there, had really no cow dairy in their diet at all. And then all of a sudden now they're being accessed, now they have access to this cow dairy, and they're seeing a massive rise in type 1 diabetes. And so researchers track this back to this A1 casein. And again, in a breakdown product of A1 casein is this BCM7. So BCM7 can create a host of different types of problems. And unfortunately too, because it's a morphine agonist, because it mimics morphine, remember morphine's a painkiller. So for a lot of people, just like I've talked about this in the past, that gluten, because there's also morphines that are produced as a result of gluten protein breakdowns. There's gluteomorphin, but there's also caseomorphin proteins. They can reduce pain. And so this is why a lot of people will consume dairy or gluten. They don't really feel bad because they're also getting a dose of morphine, and so that can actually suppress pain. It can suppress inflammation and lead to a masking of the food toxicity. So again, gluten and both dairy can be hurting you, but the morphine constituent of it could be masking the toxicity because you don't feel the pain because of the drug-like effect of the morphine mimicry. So there are also chemical contaminants in dairy, which we talked about a moment ago, so I won't go into that. There's also some evidence that shows that dairy proteins look a lot like gluten, and so people with gluten sensitivity might be reacting to them as a result of what's known as molecular mimicry. The molecules are so close, they mimic each other. We know there's added hormones, or can be added hormones in dairy, and that these added hormones can contribute to a host of different problems. We also know there are sometimes added gums. Now, I'll point this out. The added gums, generally you don't see added gums in milk directly, but you'll see it in milk byproduct. So an example of an added gum where we might see an added gum would be like a yogurt, or we might see an added gum in something like ice cream. So some of these added gums, especially carrageenan gum has been shown to elicit inflammatory response in the GI tract. And so if you've already got inflammation in your GI tract, you're eating a bunch of dairy product that have added carrageenan gum or other irritative gums, then you might be inducing an inflammatory response that feels like the gluten, even though it's not the same thing. It's two different things causing inflammation, but again, progressive inflammation. Again, a lot of people go gluten-free, and then they gravitate to these gluten-free products, and a lot of these, or even if they go gluten and dairy-free, a lot of these added gums are put in nut milks. And so you got to watch out for those as well, even though technically they're not dairy, they're dairy substitutes. But you do have to watch out for them, and because many of them are inflammatory. And if you want to check out, we have actually a very nice article on toxic gums, toxic gum additives, and you want to go check that out. We can put a link below the show for you, and you can check out that article to learn more about toxic gum. But again, these are things that people with gluten sensitivity should definitely be aware of, because if you're not, and you're continuing to eat dairy, but you're continuing to struggle, you may just work yourself up into further illness. Now, we talked a lot about A1 cow's milk, and it gave you some differences. And again, there's A1 cow's milk, and then there's A2 types of milk, being human milk, sheep and goat, etc. But these are just, again, these are alternatives. Now, just saying that, most of you aren't going to drink human's milk unless you're infants. I know most people get disgusted by the thought of drinking another human's breast milk, even though that's what we are supposed to feed humans and babies. It's certainly more compatible. Human milk is far more compatible to humans than other forms of milk. However, that being said, I realize many of you may be looking for an alternative that you can try. These, in my opinion, would be better alternatives for you to try. That being said, it's my experience clinically. So working with people for decades, that when someone's allergic or sensitive, or has a hypersensitivity response to cow dairy, generally we see them also reacting to sheep, goat, and even camel. And I know some people will say, they do better with these kinds of milk. And I'm not saying that maybe you don't. I'm just simply giving you and sharing with you my experience, which is when we see somebody and we test them and they're reactive to dairy, we generally have them avoid all dairy, including these other types. But I wanted to give you something to walk away with. I know a lot of you are thinking about, maybe you can't breastfeed and you're thinking about breastfeeding alternatives. And there are some good alternatives with goat and sheep milk as far as that's concerned. You might also check out Weston Price Foundation. They have a good recipe for alternative milk, for infant milk, for feeding, for breastfeeding when you can't. And so that Weston Price Foundation is a good place to get access to that information. But again, the bottom line is there's a lot of evidence that points to standard dairy creating autoimmune problems. Why these problems are on the rise, I think, has a lot to do with the way dairy is processed, the way the cows are fed, the way the cows are taken care of, and a lot of the chemicals that they're being exposed to. But I also think it's the way humans are being fed, and it's the way humans are pushing through as well, because we, again, as I spoke of, we have things like cesarean and chronic antibiotic use that can contribute to disruption of the microbiome. There certainly are other things that contribute to that disruption as well. Plastics, environmental toxicants, a lot of these things are contributing to a reduction in the diversity of the bacteria that we have that colonize our GI tract, making our immune systems more susceptible to react to the things that we eat the most. And remember that dairy is a staple food in industrialized countries, and one of the reasons why I think we're seeing such an increased allergic response to it and subsequent autoimmune diseases is because we have all of those variable factors happening simultaneously. And this is why it's really, really hard to put the pin in the blame game of any one particular element. But I would encourage you, if you have autoimmune disease and you haven't explored dairy-free as part of the option in your diet, you might consider doing that. You might find a profound benefit to removing dairy from your diet and your recovery process. So thanks so much for tuning into Dr. Osborne's Zone. Don't forget, if you learned something new tonight and this was helpful, leave me a comment below and make sure you hit that like button. And if you got value from this, hit that subscribe button so you don't miss another episode. Have a great day. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.